Imagine being able to spot a stroke weeks before it happens. What if you knew the subtle signs that many overlook? Today, we delve into the early warning signs of a stroke that may appear up to 4 weeks in advance. Strokes are a major cause of disability and the 5th leading cause of death in the United States. Knowing early symptoms can dramatically alter outcomes by saving lives and preventing long-term disabilities. Let's explore 7 crucial signs that could warn you of an impending stroke. A stroke, often called a brain attack, occurs when part of the brain loses blood supply and begins to die due to a blockage, known as an ischemic stroke, or a bleed, known as a hemorrhagic stroke. Ischemic strokes, which represent about 87% of cases, occur when blood clots or other particles block the vessels to the brain. Hemorrhagic strokes are caused by bleeding when a blood vessel bursts. Brain cells begin to die within minutes of oxygen deprivation, making immediate medical attention essential to save lives and reduce permanent damage. The symptoms of a stroke can vary greatly depending on the affected brain area. Common early signs include sudden numbness or weakness, especially on one side of the body, sudden confusion, or difficulty speaking. First, sudden numbness or weakness in the face, arm, or leg, mainly on one side, can manifest as a drooping smile, an inability to raise one arm, or dragging one leg. This numbness or weakness can worsen progressively if untreated. It's critical not to dismiss these symptoms, as they could escalate into a life-threatening stroke. Another key sign is sudden confusion, trouble speaking or understanding speech. This could appear as slurred speech, difficulty articulating thoughts, or inability to comprehend spoken words. These speech and comprehension issues can be mistaken for confusion due to other reasons. However, when occurring suddenly, it's a major red flag, indicating the need for emergency stroke evaluation. Sudden trouble seeing in one or both eyes can also indicate a stroke. Symptoms range from partial to complete vision loss in one eye or double vision. Vision issues from a stroke emerge suddenly, with no prior pain or noticeable eye damage. One moment your sight is normal. Suddenly it becomes severely distorted. Rapid response is vital to prevent lasting vision loss from stroke-related complications. Every minute counts in preventing irreversible damage. Vision issues linked with a stroke are painless. Your eyes might appear normal, despite significant visual disturbances. If sudden blindness, double vision, or inability to see out of one eye occurs, even briefly, seek immediate medical help. Next, sudden difficulty walking, dizziness, or loss of balance and coordination are serious symptoms, sometimes manifested as vertigo or veering unexpectedly while walking. These symptoms, often overlooked as minor, could hint at disrupted blood flow to the cerebellum, affecting coordination and balance. Ignoring these signs can lead to falls, further injury, and permanent disability if a stroke is undiagnosed and untreated. An intense sudden headache, often described as the worst headache ever, can also be an early stroke indicator. This type of headache comes without warning, hitting intensely, not easing with typical headache remedies. Severe headaches warrant urgent care, particularly when paired with other stroke symptoms like vision changes, speech difficulties, or unilateral numbness. Unexplained, sudden fatigue, hitting without a gradual buildup, can precede a stroke. This isn't regular tiredness. It's a debilitating fatigue that disproportionately impacts normal activities without obvious causes like physical exertion or insufficient sleep. While not conclusive alone, profound tiredness, especially when occurring alongside symptoms like confusion and visual disturbances, could signify a stroke. Lastly, unexplained nausea or feelings of general illness, especially if occurring with neurological symptoms such as headache or numbness, might precede a stroke. While nausea itself isn't conclusive, accompanying it with more indicative stroke symptoms, like changes in vision or speech, can necessitate urgent medical action. In summary, recognizing early warning signs of a stroke, from sudden numbness to vision troubles, intense headaches, severe fatigue, and nausea, can save lives. The faster a stroke is treated, the better the odds of averting permanent disabilities and brain damage. Never disregard these signs. even if they resolve temporarily. It's better to be cautious when it comes to stroke. If you value this information, please subscribe and hit the notification bell to stay updated with our health tips. Share your thoughts below. What did you find most informative about this video on stroke early warning signs?